Hello, friends, and welcome back to the Global Health Unfiltered podcast, a podcast about the unspoken realities of global health in Africa and the world. I'm your co-host, Desmond Jumbam, and I'm here with my co-host, Ulrick Sidney Kanmounye. Hi, Ulrick.
Hi, Des. How you doing?
Good, how are you?
Yeah, good.
So this episode takes us to Accra, Ghana, where African health leaders recently gathered at the Africa Health Sovereignty Summit, a landmark moment centered on African-led health governance and self-determination. Joining us today are two distinguished voices from that summit. Dr. Victor Bampoe, Acting Chief Executive of the Ghana National Health Insurance Authority, who has been instrumental in Ghana's health financing reforms, and Dr. Ngozi Erondu, Technical Director of GLIDE and an infectious disease epidemiologist and global health security expert who is returning to the show. Victor Ngozi, welcome to Global Health Unfiltered.
Thank you.
Thank you.
So in this episode, we'll dig into the Africa Health Sovereignty Summit, what were its highlights, what it was all about. We'll also try to understand a little bit about Ghana's health financing strategies and how it intersects with the sovereignty's agenda, and explore how global health structures can truly reflect African leadership, which is something that Ngozi has been fighting for the longest time. So why don't we jump straight into it? Dr. Victor, we'll start with you. What was the Africa Health Sovereignty Summit? Why did President John Mahama of Ghana decide to convene the summit?
Thank you very much for this opportunity, and I'm really excited to be here. So, to answer that question, I'll have to take a couple of steps back and look at what happened around January and the stop work order. That meant that a significant chunk of resources was not going to flow to African countries as usual. That kickstarted a certain discussion among some of the global thought leaders around health. Mark Dybel, Michel Sidibe, Edem Azegonu from Afro Champions and others. And they met at the margins of some of these conferences in Washington and so on, where they were thinking about how they would, seize the moment and see how Africa can actually lead the discussion around health financing. So the governance architecture. Then came in President Obasanjo. And if you remember President Obasanjo in the early 2000s, he was very instrumental with the late Kofi Annan in bringing up the Global Fund to fight AIDS, TB, and malaria. So he's done this before. So he became the product champion. They were looking for an African leader who could take this on and bring some legitimacy. And the lot fell on President Mahama, who in his own right is also a great champion when it comes to health. So that's how they, had discussions, came to see President Mahama, as he himself recounted at the conference, at the summit. And that kickstarted the health summit, which took place on the 5th of August.
Thank you for that backstory. You mentioned President Mahama at that summit, but there were also quite a few dignitaries like, former President Olive Johnson. We had the Mauritian president as well. We had Dr. Tedros from the WHO, and then the current Africa WHO lead. What were the key outcomes of the summit? Let's start at that level, and then we'll break it down. So, what were the key takeaways?
So, first of all, once you started mentioning the names of the people who were there, the challenge with this is that you're going to miss out some people. I'm happy Ngozi is here, so yes, I'll start with the distinguished Dr. Ngozi. She was there. I mean, there were lots of other people. John Nkengasong, who used to be he's headed PEPFAR, he's headed Africa CDC. Mark Dybel, who also has the distinction of being the only person who's headed two global health financing institutions, PEPFAR, the US PEPFAR, and also the Global Fund to fight AIDS, TB, and malaria. Ahmed Ogwal. There were so many other great people, Dr. Olusoji Adeyi, and so on. Asi from Kofi Annan Foundation. It was a Magda Robalo and so on. Really, really good thing. And there were 4 things that we were trying to achieve at that meeting. The initiative was trying to think around, number 1, endorsing the fact that we should come together and have a discussion about placing Africa at the center of the discussion when it comes to the governance of health financing. So it's not only just the mobilization of the resources, but how do we engage? That was important. The second one was to endorse the Sustain initiative. And I'll come back to the Sustain initiative. So it was to launch and to endorse the Sustain initiative, which actually stands for strengthening or scaling up sovereign transitions and institutional networks. That's Sustain. And the final one was to look at how a presidential task force will be launched by the president of Ghana together with his colleagues to sort of shepherd this Sustain initiative. Now, you're asking about the outcomes. The outcomes were that, first of all, it was a really useful meeting just to hear people discuss where we are and where we need to go as Africa. And as you mentioned earlier, Ngozi has always been talking about these things. So we talk about it a lot, but it was refreshing to see all these global health leaders in one room actually saying, how do we get from point A to point B when it comes to sovereignty? And the key word was sovereignty, about where Africa is in terms of these discussions. So instead of being a passive recipient of aid, looking at how we can be at the table, how we can map out the resources we require, looking at it through fiscal responsibility lens, sustainability lens, and making sure that when we come to the table to discuss what we need, we come to the table not as passive, I hate to use the word, but not as passive recipients or beggars, but looking at it, for example, through the lens of investment focus. So, for example, President Mahama gave a very interesting quote. He talked about reorienting the way we look at health, not as a cost driver, but as a focus of investment. So looking at it through the lens of trade, through the lens of other kinds of investment, so that it yields some dividends for Africa and the world. So that in a nutshell, that is how the discussion.
That's a really great quote from President John Mahama there of shifting that mindset from not just costs, but an investment. And indeed, it's an investment for Africa, which is a very young continent, and healthcare needs keep increasing. But you did mention that among the 4 key messages, there were 2 important things. There was Sustain, and then there was the high-level task force under the leadership of President John Mahama. Can you please tell us a little bit more about the Sustain initiative and exactly how the task force is going to help accomplish these goals?
Yes. So I think I mentioned a little bit. So first of all, remember that this was a one-day meeting, which was just kicking off the whole discussion. So we have a roadmap, which means that at the UN General Assembly, there's going to be an event which will bring even more leaders together. We're going to look at how we engage leaders at other events. I know that the president of Ghana, he's just left TCAD in Japan. I know that this came up and he had some bilaterals where he was discussing this. But essentially, what this is how we sell Sustain to other countries, right? So that all the other countries engage on or use this platform to look at where the gaps are, how the gaps can be placed, how we look at filling the gaps beyond the passive, aid, go to the Global Fund or go to PEPFAR, but in totality. But whilst we do that, also look at it through fiscal responsibility lens, as I said. So, I have great examples from Ghana that I can come to, but not just utilizing the funding, but utilizing it in a responsible way that makes you accountable to the people so that the trust is built. So it's a whole different paradigm shift. Now, where we want to get to is for Sustain to be endorsed and used by different countries so that the presidential high-level panel will be some kind of platform where we can look at the different models of Sustain from different countries, do some peer learning. So, for example, in the National Health Insurance Scheme in Ghana, I'm sure you know that when President Mahama, who's a great advocate for health in Ghana and in Africa, many examples I can share, he did something where he actually, because a cap had been placed on resources that were coming to the National Health Insurance Scheme. I'm sure you know that over 90% of the funds that come to the scheme come through the taxes, the National Health Insurance Levy, which is 2.5% of value-added tax. Because we were squeezed, fiscally, the previous government had put a cap on it where only 25% of all this funding was being distributed to the 16 statutory bodies that receive these funds. When President Mahama came, he said, look, I'm going to uncap this so that more resources will come to the National Health Insurance Scheme. He did indeed do that as one of the first things that he did as president, which means that we have 3.5 billion cedis more, which is maybe $320 million more coming to us. It also places a responsibility on us. So I'll give you an example. Last year, and I'm not proud to say this, but last year, Ghana had to borrow vaccines from Nigeria, from Cote d'Ivoire, because we couldn't meet on time the funding that we had to give to UNICEF and Gavi. This year, what we did as one of the first things is to pay off all that funding, because we know that we pay $26 million every year as counterpart funding for vaccines. But because we're a lower middle income country and we're going to maybe upper middle income, in 2-3 years, we'll have to transition out of that and we'll be paying maybe 51 million or more. But because we have more funding, we're channeling the funding to the things that matter. And so when we were with the president of Ghana at the Brussels meeting for Gavi, where they had their replenishment, he was able to announce, for example, that for the first time in many years, we had actually paid this very quickly at the beginning of the year. We're paying our counterpart funding to other development partners. And the president himself asked the Minister of Finance to put aside $156 million to plug that hole that has been left by the Trump stop work order. All this is not new money per se. It's channeling the money to a place where, it goes back to support what the president said about not looking at health as a cost center, but more like something that you can use as an investment center.
Yeah, it is definitely interesting to have all these lessons learned from Ghana and to have Ghana hosted, because like you mentioned, there's so many examples from the National Health Insurance Scheme and the authority handling of the breadth of coverage and protecting Ghanaians from catastrophic and impoverishing health expenditures. And like you say, President Mahama as a champion, perhaps even later we can talk about what that means for your authority agency and the Mahama Cares plan. But I was really intrigued. I was really intrigued to see that you didn't just carry it, but you pushed it forward. I guess, Ngozi, as an attendee of the event, a participant, how did you feel the summit framed sovereignty in a way that was different from any other conversations in the past?
Yeah, thank you so much, Ulrick. And I'm really pleased to be on the show again, especially for this important topic and with the esteemed Dr. Victor. Yeah, it was excellent being at the summit. I think what's most notable is that, we've been talking about reimagining global health, and we've been talking about, how to respond to the USAID cuts in January. But even before that, as you have said, and as we spoke before, just before COVID, we've been talking about the need to kind of move from this dependent model to a more kind of African-led having agency model. And I would say for me, and I've attended many global health conferences, this was the first one that I really felt was one truly led at the presidential level, having the president of Ghana, corral all these global health leaders was really, really important. And we saw that during COVID. Everything cannot be stuck at the health level. It can't just be ministers of health that are moving things, because health happens to us at work. Health happens to us, when we are crossing borders, when we're traveling. by flight and by boat and other means of travel. Health happens in migration and humanitarian crises. And so it really does need that head of state leadership. And so I think that was like the first thing is that, oh, wow, this is really at the presidential level. And so pleased to hear, Dr. Victor, and also what came out of the communique, talking about that presidential task force, because that's what we really need if we want true sustainable change in Africa. I think another point that really stood out was just, I think constant referral to kind of the aid dependent era as the old model. We very much are in a paradigm shift, as Dr. Victor said. And it was really exciting to hear. Yes, it was just one day, but it really was, kind of bringing together not just public health leaders across Africa, but across the globe that have been kind of talking the talk like I have. And as Dr. Victor said, this was very action oriented. So constant referral to the kind of the model that we had just a few months ago as like the old model, it brought me a lot of joy because it made me really hopeful that this new narrative wouldn't just be talk, but it would be lead to this new model of kind of action and African leadership. I also really liked that there were so many regional organizations represented. You had the African Medicines Agency, you had African Centers for Disease Control and Prevention. There was the Auda NEPAD group from the African Union. You had, kind of African regional offices in philanthropy, such as the Gates Foundation. You had the African Development Bank. So it really was, again, this beyond health agenda that it's not just, the ministers of health and these NGOs that are going to get this done. This needs to be a full agenda if we're talking about reimagining the global health architecture and it being African led. And we have to remember that when global health is such a weird term because it often means, public health somewhere else. And often Africa is at the center of that, whether it be through clinical trials, research evidence generation through research, or, public health crises and response. Africa is often at the center of it. And for the longest time, it's been very dependent on externals to come in, even though we have excellent cadre of, public health professionals and clinicians as well. So I think it was really good to kind of reclaim global health, and say, well, we know that Africa has been at the center, but now Africa needs to shape and to lead it. So those are kind of the big things that really stuck out to me. Oh, actually, I'll add one more thing. I think, usually when we talk about global public health, we're talking about, reducing morbidity and mortality. And of course, that's really important. And that's why we have, these kind of disease specific initiatives, but also, some integration when we think about the Global Fund and HIV, malaria, and TB. But really, it's often like, big disease led. Um, and I think that just like in other countries or other regions of the world where, yes, they are consistently strengthening their primary health care so that they can detect, prevent, and respond to infectious disease threats, there's something about looking beyond that. And I think especially that this conference was or this summit was hosted in Ghana, really helped us to be kind of forward looking, thinking about new and bold opportunities to shape African architecture by not just being kind of responsive to infectious disease threats, and even not just focusing on prevention per se, but also realizing much bigger kind of structural changes, such as what Dr. Victor is leading in Ghana. So, national health insurance and thinking about, again, strengthening primary health care and those basic packages of interventions. It just helped us to really, I think, imagine what every African country could look like if it could provide, first line primary health care services to its population. And then we would be the ones to invite others to come in if and how we needed to. So I like that reframing a lot. And those are kind of my first impressions.
Thank you, Ngozi. So I want to ask a bit of a critical question here. Is these discussions have been happening for a while. The need for sovereignty. It was obviously catalyzed by, President Trump's, USA cuts. But back in 2001, we had the Abuja Declaration, a lot of African heads of states committing to at least 15% of their national budgets towards health. Very few, I would say maybe, not up to 5 met that target. And so my question to both of you maybe starting with Ngozi, is how do you see this movement different from the Abuja Declaration? Right? Is it something that that is different in some ways as opposed to what happened back then?
Yeah, thanks, Desmond. I think it's a really important question. And actually, Dr. Alosoji Adeyi, he, we all know his work. We know he's very prolific when it comes to kind of warning African countries to go forward and not go back, and also to have their own agency. I think that he and others, like Dr. Ebere Okereke as well, talked a lot about, how do we move forward and not kind of not in 10 years look back and say, oh, we were at that that summit in Ghana, we had all this goodwill, but it didn't lead to anything. I think that, in the early 2000s, there were a lot of good initiatives, such as, the Global Fund and Gavi, and a lot of things that had been kind of resurrected to help African countries, but low and middle income countries everywhere to, again, counteract the morbidity and mortality from infectious diseases. But one thing that Dr. Adeyi said is that none of those had a sunset date. It was just that they were supposed to be there in perpetuity, basically. Yes, with Gavi, you can graduate and as you become a wealthier country, but still, like, as with a lot of global health architecture as it is, it exists to keep jobs, right? Like, I think that was we might not like the way Donald Trump did things, and I really do not. It was abrupt and it was, destabilizing, and a lot of people will lose their health and their lives because of it. So I'm not saying that was good the way it was done, but the fact that it happened, none of us should have been surprised, really. Like, another country cannot provide health for a different country. That's just not how the world works, and that's not how we should want it to work. And so I think, of these structures that kind of looked like they were going to go on for infinity, they allowed African governments to really not invest as much as they should have in their own health system and their own healthcare platform. So Dr. Adeyi said a lot of things that I thought was really interesting. I've tried to remember, maybe Dr. Victor, you would remember, but he talked a lot about he talked about cycles of dependency. He had a word of basically saying that we've sabotaged our sovereignty by allowing these larger platforms and these larger programs to continually be a crutch for African countries. I think that's one. I think also that we can be more specific than what we had at the Abuja Declaration. I think that we can, like, again, as I said at the beginning, health is beyond the Ministry of Health, right? Like, when we talk about One Health, there can be programs that include, agriculture, animal health, that impact human health as well. And I think that when we think about, having 15% of, country budgets allocated to health, I think we need to really think about how that can happen across the government, actually. And I think if we're more specific and we give more direction and instruction, I think that we probably could reach those levels that we put out in the Abuja Declaration. So I think there's an issue with, defining it better and encouraging like this beyond health approach or health in all policies approach, as well as like these structures that were a crutch that allow for governments to kind of put all of their, vaccine responsibility, all of their response, like outbreak response responsibility, and all of their kind of the largest diseases that affect their population, those responsibilities in the hands of external organizations. And so hopefully moving forward, we won't do that.
Maybe just to add my 2 cents worth, and Ngozi, I love the way you framed it. Excellent points, really, really excellent points. Just to add a little bit of it to what you said, throughout the summit, I think it dawned on everybody. It's dawned on everybody from the beginning of this year that things are not, as they've been in the past. So there's a proverb in my language that actually, translated says, when you advise somebody, sometimes it doesn't go down. It's experience that makes people feel what is actually happening. So there was a lot of talk about this being an inflection point. That this time we really need to do. So Abuja was about how much. This time people were asking, how should we do it? Moving beyond just the domestic resource mobilization to the manner of engagement, the fact that they're talking about sovereignty. Who should be at the table beyond health? And Ngozi has made that point repeatedly. So looking at it in a multi-sectoral manner, because it goes beyond just the health minister going to cabinet and asking for 15%. It goes to the finance minister saying, I need to pay for these vaccines because when I pay for vaccines and I look at prevention, it's going to reduce my cost when it comes to curative, when it comes to cancers and whatever, So there's a whole discussion. But I'll give you a few quotes that people made, because there was also the feeling that there's a threat that this will just be a 9-day wonder. I'll start with Dr. Ahmed Ogwell, of Village Reach. He said, what happens in Accra must not stay in Accra. I'll go on to what Alhaj C of the Kofi Annan Foundation said. He said, too many promises have been made, too many promises have been broken. This time we should try to do it differently. Dr. Tedros, WHO Director General, he said something profound. He said the difference between crisis and opportunity is leadership. And Africa should stand up and lead and move away from where we are perennially asking people to come and solve our problems for us. There was a certain feeling in the room that this time it's not going to be business as usual. And I do hear you, because there is that risk. But I think it behoves us to actually follow up on these discussions and action some of the things that we've decided to take up. Minister of Health of Nigeria, coordinating minister, the Honorable Mohammed Pate. I wish I could share with you the 15 points he made at the beginning. Fantastic points about where Africa finds itself now and why it's important that we either seize the moment now or we are lost forever. So I think we all left feeling a certain resolve that we're going to do things differently. And here I must pause to remember that unfortunately, the day after the 5th of August, we had a terrible helicopter crash, which took away 8 gallant Ghanaians. One who was sitting right next to me throughout the session, Dr. Omane Boama, who was also a physician himself, Minister of Defense, and one of Ghana's smartest politicians. Unfortunately, the next day, they were involved in a helicopter crash. But I say this, number one, to pay homage to them and to remember them, and to remember that some of them on that helicopter were invested in this. But secondly, also to give an example of how this slowed down the release of the communique and some of the other things. But immediately after the mourning period, and I think this is what the 8 who lost their lives would have wished for, we would slow down for a few days to pay homage and to pay our respects. But we are now back on track. I'm getting calls from the president's team in Japan saying, what are we doing about the UN General Assembly? What are we doing about getting? And interestingly, we're seeing some of these meetings being replicated around Africa. In Nigeria, I saw that there's a reimagining conference, and Nigeria has shown great leadership from President Obasanjo, who actually must be the one person we must thank for bringing this together, because I will not be able to say this, between President Obasanjo and Dr. Azegono, when there were threats to this meeting coming up, they actually pulled out all the stops to make sure that this came, So Nigeria, once again, congrats and kudos to Nigeria. I know Dr. Ngozi, but this is something that has come up and has come about because people think that this time it has to happen, and the examples are there for all to see. So we're not going to drop the ball at all.
Yeah. I can't help but be a bit more optimistic than usual with this process. First, because the location was, like I said earlier, time was the right one, Accra. And like you mentioned earlier, this is after uncapping the National Health Insurance Fund. We're still across the continent struggling with universal health coverage and having national health insurance schemes. I think it's fair to say that on our continent, when we're looking at better examples, we can think Rwanda, we can think Ghana. Obviously, Ghana's trying to increase the depth of coverage and going in that direction with uncapping, it definitely makes sense. So about that uncapping, perhaps if you can, I guess, break down for us what that means now for your authority and agency and what that will mean for Ghanaians now that you have access to, you mentioned about 3.2 billion Ghana cedis extra.
So the uncapping has actually revolutionized the work that we're doing because it's brought in, much more funding. But more importantly, what it means is that, as you rightly said, we have 56% of Ghanaians, or last year we had 56% of Ghanaians on the National Health Insurance Scheme. This year we are pushing to go to 60%. So it means that we can pay health providers more rapidly than we used to do. It means that this can give the health facilities the funding they need to provide the services that they've been providing to Ghanaians. But then there's even something more interesting, and I think it was mentioned earlier. What the president of Ghana has also done is to introduce two things. One is the Mahama Cares, because if you look at Ghana, fully 40% and a little more of our all-cause mortality is now coming from non-communicable diseases. So the National Health Insurance Scheme, when it was birthed over 20 years ago, was focused mainly on curative and also on communicable diseases. But we're trying to change. So some of this money is going into this Mahama Cares, which is looking at strokes, renal failure, cardiac events, cancers, and so on, and making sure that we can cover this, because this actually causes even a higher financial burden on people, And I think what the evidence is showing us is that when Ghanaians have somebody in the family has one of these adverse events, maximum a year, there's some kind of penury. So there's a serious effect on the family. So that's one side. Then, of course, I think Dr. Ngozi mentioned earlier about free primary healthcare, where we're also looking at having free primary healthcare, a basic minimal package of health services based on diagnostics, based on vaccination, based on promoting health. So what we're trying to say is that we're giving end-to-end coverage for healthcare. And we hope that as we catch more and more of the diseases through the preventive and the diagnostics and the vaccines, we would be reducing the burden eventually on the other end. Not a lot more diseases will be going right through to end-stage renal failures and stage 4 cancers and so on. But this has all been made possible because there's much more funding that we can apply to this. And the president is very committed. The Minister of Finance, Minister of Health, they check in with us every day to make sure we have our funding, that we are paying, the health facilities, and that Mahama Cares was launched a few weeks ago. The free primary healthcare will be launched a few weeks to come. We're hoping that in the next 6 months to 1 year, end-to-end coverage will be in effect.
Yeah, and with that extra money comes a lot of financial responsibility. I'd be remiss if we didn't highlight that. I think your agency, the NHIA, has already paid up about 50% of the monies required. But interestingly, there was a report of your services going after those who are making fraudulent claims. That's something that in our parts of the world is even just as damaging, if not more damaging, than the actual depth of coverage. So can you maybe touch on that?
So, you are spot on. We are not only looking at the quantum of resources, we're looking at the efficiency of the use. Because, as you rightly said, we have a significant challenge with two things. One is fraudulent claims, and the other is, despite the fact that we are now paying health facilities more readily and more rapidly, there's a certain culture of out-of-pocket payments that was begun when facilities were not being paid quickly enough. And it has stayed where there's double dipping. So the facilities get paid by the National Health Insurance Authority and yet still charge the patients. And we're trying to stamp these out. You may have noticed that a certain hospital in the last couple of days was cited for some of these irregularities. And we are clothed with the legislation to actually call these out, and to deal with it. And we're going to make sure that we deal with it, so that the monies are used in the most efficient way possible. And I must tell you also that my bosses check in with me very regularly and with my executive management. Number one, to make sure that the money is being used properly. And number two, to make sure that all these checking on the health facilities and so on is going on, and reports are coming out regularly to make sure that we're on track.
So the National Health Insurance Scheme in Ghana is I think, excellent example of what happens when health decisions are made by the local authorities. And that, I think, that can be attributed to the fact that a lot of the funds, all the funds for that is raised locally, right, through the tax levy. And so that allows for decision making. For example, this uncapping will allow you to include preventative care, expand preventative care through the National Health Insurance Authority. But I think that one of the biggest challenges that the summit was aiming to achieve was moving away from this donor-driven payroll schemes. And Ngozi, can you remind us some of the risks that are associated with donor-driven payroll systems and how that undermines our healthcare systems in countries and the way we finance and make decisions?
Yeah, thanks for the question, Desmond. Yeah, I think the risks are really well known. I mean, we've talked about this already as far as, not having funding going across the health system for needs that reflect the population, right? When the decisions are made outside of the country, then you're not really addressing this rising non-communicable disease increases that Dr. Victor talked about, because all of the funding when it comes to global health usually focuses on communicable diseases. And so that's one, our infrastructure when it comes to cancer management is really, really poor in Africa. We're losing people. People are dying very early from, health conditions that are managed really well in other countries or are prevented altogether. So just not being able to have a comprehensive healthcare system is the main risk, I would say, but there are other risk as well. And I'm so glad Dr. Victor brought up Dr. Mohammed, Professor Pate, the coordinating minister of health and social welfare in Nigeria, because his speech was excellent. And he really talked about, so your question is about risk, but I feel like he really kind of juxtaposed opportunities with not only the risks, but the realities that we have right now. So he talked about, focusing on African data sovereignty by coordinating how Africa standardizes, regulates, and protects its health data infrastructure. Because the risk right now is that health data is often taken out of Africa. It's, a lot of these global burden of disease studies, we talk about the analysis being done in a black box. We have no idea how we necessarily get the information from, the health facility in Nigeria or Ghana to, the Lancet publication that's saying what the morbidity by malaria in different countries, like where that comes from. It's really hard to have confidence in some of these data and these figures when we know that the kind of data collection quality might be poor. We know that a lot of the data that we have are in university spreadsheets and not universities that are necessarily set in Africa or NGOs as well. So I think data sovereignty is a really big thing because when we own the data, when we use the data, then we're able to use that data to make better decisions and to make decisions that are precise and reflect the actual need. So I think that's a very big thing. This move to sovereignty also helps us to choose who we work with. Professor Pate talked a lot about, establishing strategic links with Asia, Latin America, and the Caribbean on health security and governance. And we've spoke about before how, when we talk about global health security, it's often about keeping, deadly pathogens in poor countries so that they don't affect rich countries. And we can totally restructure what that means. We can totally reimagine what health security means for in the African context, but with more South-South collaborations of countries that have more of a similar kind of history and background as we have. So I really, really appreciated that as well. And again, I think the risk of continuing in the old way is that we will never strengthen not only our kind of country health systems and the governance within countries, but even at a regional level. I'm really excited that the AMA now has Dr. Mimi leading it, because we need a regulatory authority across all 55 countries. We need to standardize the way that we review and regulate medicines, because otherwise it's going to be very difficult to bring in new pharmaceuticals into the African market. It's going to be very difficult for people to even appreciate and regard the African market as one that is worthwhile to invest in, right? And it's going to be very difficult to, really move this local manufacturing agenda forward if we don't have a good regulatory authority across the continent. So the huge risk of not transitioning from kind of the old model to this new architecture and the new paradigm that we've been talking about is really having weak or non-existent regional entities that can really connect us and make the goals that we have more achievable.
Yeah, I see that what you're mentioning and the theme of the conference, sovereignty, there is perhaps a risk as well that I'm sure you were able to tackle for the conference, which is we are talking about sovereignty of Africa versus, say, other institutions outside of Africa, but there's always a risk of having too much sovereignty, if we will say, within Africa, which then leads to redundancy, duplicating efforts, and that inability to learn from one another. But fortunately, we did see, like Dr. Bampoe mentioned, that this was led by former President Olusegun Obasanjo. But you also mentioned, Dr. Bampoe, that there was a need for multiple organizations to come together. So if you can talk to the fact that there is the collaboration that's needed, maybe intra-continentally, but even nationally, of, say, the Minister of Finance, like you were talking about, to make sure that this Africa health sovereignty is actually a reality.
So maybe just to add to what Dr. Ngozi said, and Honorable Minister Pate was really, really excellent. And I think one of the points he made, and I'm bringing this up because Ngozi also talked about the continental, the organizations like Africa Meds, because he made a strong point also about mission creep, and to make sure that, the organizations don't fall over each other, trying to be doing things that are in the areas which are most attractive and so on. So that's a real threat that we face. It's a clear and present danger that we need to deal with. The second thing is that sovereignty doesn't mean isolation. So it actually means that we go better prepared, we go engaging with sometimes our comparative or competitive advantage in place, and moving from passivity to being more active, discussants. When I worked at the Global Fund TB to fight AIDS, TB, and malaria for a decade, I was a senior fund portfolio manager and a regional manager at some point. And I'm sad to say that in the past, I think it's gotten much better. You would find that some countries that we deal with, not all in Africa, but some countries would just be waiting for you to tell them how much they'll have, in which areas they should apply the funding and so on. And you found that some countries were more actively engaged, would push back. Invariably, when countries told us what they wanted to do, we would accede to their demands and let them have their way. But sometimes you find that there is a vacuum. You wouldn't find people engaging. And I found that sometimes in African countries, because of the benefits to programs that came from the Global Fund, some of the discussions around the Global Fund were capitalized. They were not socialized across government until there was a problem and the money had to be paid back. Then the Minister of Finance would come in. In so doing, the discussions were not across government. They were in silos, and sometimes they didn't bode well. So this new paradigm is moving to a place where needs of the country are discussed across board, and the resources that are available are discussed and, shared in a way that is fiscally responsible, looking at sustainability. And I think this new way is something very different that would help African countries.
You mentioned, Dr. Victor, that there already is some progress. Some African countries, like Nigeria, for example, it's all hosting its own summit. But would like to know how regional bodies, governments, civil societies can collaborate on the outcomes of this summit, right? How do they play a part in moving this summit? I know we're still at the beginning, but again, this is the best time for them to be involved, right? So how do they play a part in moving this from symbolic declarations to like real concrete scalable action? So Dr. Victor, you can go first and then Ngozi.
So I think the key, two things. I talked about 3 or 4 things we wanted to achieve. First was to bring people to convene. Then second one was to launch Sustain. And third was to launch the presidential high-level panel, but all in a bid to align, our thinking process and the actions. So what is going to be key is this presidential high-level panel, which is going to have people from across, from academia, from civil society, and what they will be doing with high-level leadership. There would be a political group, which is at the very high levels of the political space, and then a high-level technical group with some of the leaders that we saw at the meeting. What they would be doing, of course, will be charting a certain roadmap for countries, would be encouraging countries to replicate this at the country level, where they will be having a stakeholder analysis led by government, but with civil society and other elements of human endeavor, coming up with this gap analysis and ideas about how they can plug this gap. So I know the question will be, but we do this all the time. But I must insist that this time is going to look at it not only from the health sector, not only waiting for the Global Fund of PEPFAR to bring the 20 million or the 200 million, but looking at it in terms of trade, in terms of international development, in other spheres, holistically, with civil society and others at the table, but then also learning from examples. Ghana has examples to share from the National Health Insurance. Nigeria has great examples. Kenya does. Rwanda does. Cross-fertilizing these examples. We're not saying it's going to be easy. It's just the beginning. But better to have that discussion now and to start now than to wait till things get worse. And I'm going back to something that Ngozi said. What happened in the US was not pleasant. Nobody is happy that people are going to lose their lives because a lot has gone on. That it means that there's a reversal of many of the gains that we made. People are going to lose their jobs. But better for us to start now than for us to start tomorrow.
Excellent.
Yeah.
Did you want me to come in? Okay, great.
Yes,
No,
go
that
ahead,
was
Ngozi.
excellent, Victor. I really appreciated that. There's so much for civil society to do, I'd say. But I think that it's not just about government setting what civil society does. In fact, that never works.
Yeah.
Government can invite civil society, but civil society also has to define their own role. And so I think this is critical, and I'm glad that this was one of your questions, Des and Ulrick. So, in one of my past lives, I was part of the PEPFAR Watch, which was a civil society organization built to keep PEPFAR accountable, but also was really comprised of a lot of HIV activists, academic institutions, NGOs that were really pushing to ensure that what PEPFAR funded was what the folks that were most suffering from that disease needed, and ensuring that it was, so led by people living with HIV, but also led by the governments even that were engaging with PEPFAR. And what I learned from being part of PEPFAR Watch is that, civil society never sleeps. It's about being on top of the latest policies. Civil society will be at UNGA. Will they be at this meeting? If they're not at this meeting, will they have their own meeting? It's important for civil society and government to build bridges, to nurture relationships so that there's this constant communication and complementary activism and action to ensure that this effort goes forward. A real sovereignty does not just happen in the halls of government. It will not just happen at the ministerial level. It has to be at so many different levels, and that's where civil society really comes in. I'm also part of the UnitAid NGO delegation, and again, a lot of the work there is, reviewing different potential innovations, reviewing for that, it's really specific about like, looking at areas of investment for funding when we think about either countermeasures or new diagnostics or new equipment and things like that. But it's also engaging a lot with the leadership at Unitaid, with the board members, being able to kind of package our arguments, our justifications in a way that can be heard at these different events and forums and board meetings. So I think there's a lot to do. And I think that it's not just, again, it's not just civil society in the in the health arena. Another thing that, and I call him Professor Pate because I know him as a professor, but it is Minister Pate. Another thing that Minister Pate talked a lot about was the African continental free trade area and the amount of opportunity that could have for us when it comes to reimagining global health. So, having more job opportunities across countries and being able to hire more easily. And I know there's quite a bit of CSO or civil society organization activity around the AFC CFTA. So I think that partnering with, folks that are working on ensuring that there's more, youth engagement when it comes to making AFC FTA work for African youth. I think that's really important because we need that in the health sector. When I have visited Belgium in the past and gone to GSK or gone to Merck or all these different pharmaceutical companies, they're like cities, and they require a lot of people to work there. They require just so much institutional knowledge. And we have the youngest, continent in the world. So there's a lot of, resource there, but there has to be that vision, that plan that is 30, 40 years looking forward. There has to be that education plan in the pipeline to make sure that the talent is getting to this new local manufacturing agenda. And again, that can't just happen in the halls of government. There needs to be a lot of civil society that is pushing that forward, and a lot of agendas in African academic institutions that can really, give estimates to like what is needed when we talk about the African health workforce, that can give you kind of policy direction and input when we're talking about the free trade area policy, and but also talking about, we move forward as far as pushing domestic financing and domestic resource mobilization, but also inviting global health actors to work with us when we want them to work with us. I'm actually really excited about Sustain because it talked about, doing that gap analysis, understanding how much we're paying for health right now, but how much we need to pay, right? So there's going to be quite a bit from what you said earlier, Desmond, of redundancies and duplication that we can just kind of cut off and say, we were already overspending for this. And what more could we do with this amount, or what can we do with the amount that we actually need? So I think having that type of information, the concrete data that can help us make decisions and move forward is a real role for academic institutions and for think tanks across the continent and beyond. So there's quite a lot to do in civil society.
Maybe just to add, and I like the way Ngozi framed it, it reminded me of the quote from Cecilia Senu, who is a Ghanaian civil society champion and the leader or the head of Hope for Future Generations. She says something profound. She said, sovereignty is not about power. It's about people. So it starts and ends with the people. So we hope that we get it right, and it's not just one side telling the others what to do, but making sure that everybody's around the table, as Ngozi very aptly described. Once again, I must warn that those are the plans that we have. We must actualize them, and part of the sustain would be to make sure that we have a monitoring process in place to make sure we're getting it right and learning from countries that are doing it better than others and moving forward together as Africa.
Fantastic call to action there. So just as we wrap up, you told us earlier, Dr. Bampoe, that the next big item is New York for the United Nations General Assembly. What can the public expect from
So UNGA is really just one more step in the journey for those who were not able to make it. I think the equally important part is coming out with the report for His Excellency the President to confer with his fellow heads of state and ex-heads of state and come up with a presidential task force and to map out how sustain is going to be implemented or operationalized in the different countries. I'm glad to say that, it looks like the Accra meeting made some significant steps. So there's this reimagining conference going on in Nigeria. We hope that this will be replicated. And so the seeds have been sown, and that this will coalesce into a movement that maybe in the next few months, we may have to call another meeting to see where we are at and then see what progress we are making. And as we go, every great journey starts with one step. And the step that was taken in Accra, I think, was a bold step, visionary step, with a lot of commitment. And it will be a shame if it becomes one of the other meetings that was convened and nothing comes out of it. So I don't think that we want to see that, and we'll try to make sure very much under the leadership of our presidents, and ex-presidents, to move this forward.
Thank you very much. And Ngozi, to close us out, you are not just a participant and attendee in this summit, but you are very much an active participant. You've been championing this for a while. And so for you, as somebody who's been advocating for this, what do you see as your next role in the African sovereignty? Like, not in terms of the next role, but what are your steps?
I was like, wait a minute, you're going to give me a new job, Desmond? That would be great. Yes, what I'm looking out for is, I would say, I heard about the presidential task force, and I believe, there's UNGA, but there's also, I believe, Dr. Victor planned to meet in 6 months, like with the larger presidential task force. So I'll be looking forward to that meeting, and I'd like to hear, who has taken up the sustained framework or something similar in their country. I'd like to hear about, global health initiatives that are African centric. So just imagine like Africans led, African designed SDGs with, actual strategy and cost associated to that. Like, obviously it takes time to do all of that, but I will be looking out for that. I really liked what Dr. Adeyi said. And so what I would like to see is movement around, this sunset clauses or transition plans when it comes to the larger global health programs and platforms. There has to be a plan to move forward. I always say this, and, as I get older, maybe it sounds cornier, but like when you fall and somebody aids you to get up, they don't continue holding your hand, forever. They just help you up and then they walk away. And so we need a plan to walk away. And so we need to actually move that from a rhetoric to reality. So I'll be looking for that. Also, new innovative finance mechanisms, again, designed by Africans, inclusive of Africans, but also people outside of Africa, that is trying to, how do we address the diseases that are most impacting us? How do we get that catalytic financing, or just have, different ways of looking at even the pipeline when it comes to developing new products. There's so many diseases and health conditions that are overlooked because they don't make money for Western pharmaceutical companies or Western innovators, basically. So how do we get that, investment into dealing with the problems that we need? And then I think on like a micro individual level, I would like to see new confidence in Africans, in our leaders, but also in us, all of us who lead NGOs, who work in academic institutions, who work in government institutions. We should have a new confidence. Like, we've been saying this before, that aid has never been charity. It has never been, just the goodwill of people from the West or from the global North, or however we talk about countries nowadays. It has always been transactional. Donald Trump is just louder with it. He's just louder with what we already knew, right? So if you knew it was transactional and you knew we were exchanging our resources, whether it be our knowledge, our data, our minerals, whatever it was, if now you know that you hold a lot of value. So how do you show up when you are talking to new partners? If it's a research project or if it's getting new funding for a regional entity, how do you show up? How do you ensure that co-creation really means co-creation? It's not somebody giving you something that has already been developed. So I would like us to just come with a bit more swag than when we talk about global health. So yeah, that's what I'm looking forward to.
Well, with that, I think we've come to the end of the episode. I must say that I end the episode being very optimistic about the future of African health sovereignty. And, it's been a long overdue action that needed to happen. So, Ulrick and I and Global Health Unfiltered will be following very closely. And I would say, we'll also be holding all accountable as much as we can, here on Global Health Unfiltered. But Dr. Victor Bampoe, thank you very much for joining us. And Dr. Ngozi Erondu, it was a pleasure having both of you on Global Health Unfiltered.
Thank you.
Thank you. Thank you very much.